New research is showing that poor health among millennials is driving up the cost of insurance and our premiums. Paul Seegert is an analyst with PCS Advisers, healthcare insurance benefits consulting firm. Paul, nice to have you back on the show. I was surprised at the findings here from this study.
Yeah, it is very surprising. We've been told for some years that the millennials are the wellness generation.
Yeah.
And actually, the research is showing that they are on track to be the most obese generation in history. 7 out of 10 are on track to be obese by the time they're in their 40s. And as you know, that leads to all kinds of health problems, chronic health conditions that are expensive to treat.
And so are we already seeing increases in our premiums because of this, or is this something that we're really going to have to pay the piper down the road?
It's not yet at a crisis point, but it's headed there. If we don't do something about it, then it will get there. Their health costs the health care costs for a millennial are about 33% higher than the generation before them, Gen X, and the generations before that.
Do you think this has caught not only the health industry, but a lot of people off guard, or were they kind of anticipating this? Because it seems to me like this is kind of surprising news.
I think it is a little bit surprising. In prior years, all the polling suggested that this was the most health-conscious generation in history.
Right.
And most focused on wellness, most focused on healthy eating choices. They care about their health package at their work and other perks more than generations before them. But what we're seeing is that their amount of screen time that they have is impacting their mental health, that many of them don't have a primary care physician, and the convenience and the ability to have food delivered is leading to bad food choices oftentimes.
And that could could cause some irreparable harm later on, not only to them, but the economy as well. Paul, thank you for your insights. As always, it's interesting to hear such a unique perspective on this. And we'll check back in with you for the next study that comes along. Paul, thank you.
Thank you.